Connective tissues are composed of three components: specialized cells, extracellular protein fibers, and a ground substance. In many connective tissues, such as this tendon, this elastic tissue, this dense irregular connective tissue, the fibers are visible and obvious. In other connective tissues, they are not as obvious, but they are still present. In blood, for example, blood plasma contains extracellular proteins such as albumins, globulins, and fibrinogen. Solid connective tissues, such as cartilage and bone, possess extracellular protein fibers, but they are not visible because of the dense matrix. So, if one were to decalcify bone, remove the calcium and thus the hard hydroxyapatite matrix which bone is composed of, one would see around the cells the collagen fibers which compose a quarter of bone. And so, these important fibers have a role in making bone more flexible than it would otherwise be. Pure calcium phosphate is very brittle, and so thus bone would not have its strength, which is comparable in life to the strength of steel reinforced concrete, without these collagen fibers. And in decalcified bone, one can observe these fibers, which are expected. Once again, bone is a connective tissue, and a quarter of bone is the extracellular proteins collagen.